Jason Wallace, CEO at New Horizon Health Center.
What inspired you to get into the medical field?
Uh, well, that's a long story. Really, I was working in another industry when 9/11 happened. And if you remember what happened to the economy shortly after 9/11, it was pretty devastating to a lot of people. And it was at that moment that I realized, okay, I was going to go back to school and get my graduate degree. And when I did that, I did a lot of extensive research. Where's the growth happening that's recession proof over the next 20 years? Everything pointed towards healthcare. And then I spoke to my father, who started his career before getting into public service and city government. He was in healthcare administration. So that's what I decided to do, was to just go back to school, get my MBA with a concentration in health service management. And from there, that's what really just piqued my interest and my compassion to this industry and the impact that it has on everything that we do. Health is at the core and root of everything that we all want to do and aspire to be. It starts with our health. So that really grew from that education and then getting my first job in the field.
So, can you tell me about New Horizon?
Yes, we are a community health center in Brownsville, Texas. We are an FQHC, which means we're a federally qualified health center. So we community health centers, there are 1,400 across the country. Uh, Community health centers serve 1 in 13 Americans across the country. So we are really at the core of primary healthcare services in this country. At New Horizon Health Center, we are designed and serve and created to serve the uninsured and underinsured communities. But we also take anybody who has insurance, Medicare, Medicaid as well. Oh, the interesting thing about us is we don't discriminate on anyone's inability to pay for the services that we provide. If someone is qualifies for our sliding fee program based off of their health, the size of their household and their income, then they can pay as little as $25 for a medical visit or as low as $5 for a behavioral health visit.
Yeah, with that, I'm in therapy, and sometimes it gets pricey. But how important is it to remove the high cost barrier for people looking for mental health care?
It's crucial. The most important thing in counseling is for people to complete their therapy. And what we were finding is that because of the cost and the decision that people had to make between, okay, am I going to go to my therapy or am I going to put food on the table for my family? They were choosing putting food on the table for their family. So some of those issues that they were having were not going, they were going unresolved. And when you talk about the health of a community, that can be impactful and manifest itself in a lot of different ways that typically and usually aren't positive ways. So if we wanted to remove that financial barrier and make it such that people put completion of their therapy at the forefront of their actions to get better and healthier and improve their overall well-being.
Yeah, with that, what are some of the other programs and things you help out people with?
Well, we have adult services, we have pediatric services, we have women's health, which includes OB and GYN services. We have podiatry. We have an eye clinic. We have an in-house pharmacy where we are able to because we are an FQHC that I talked about, we're able to buy drugs for pennies on the dollar compared to other retail pharmacies. So we're able to pass those savings on to our patients, so that they can afford some of those more expensive drugs. And again, take their medications that are going to impact their overall well-being and their ability to control some of the chronic illnesses that are prevalent in underserved communities. We also have nutrition services on site. We also have some specialists on site as well, including rheumatology as well as podiatry, like I mentioned, and then our eye clinic. So we are a one-stop shop. We have an imaging center with bone density scans and X-rays and ultrasounds and sonograms. All can be performed here. We have enabling services to help people enroll in either the sliding fee program that I talked about earlier, or Medicaid, or any of the marketplace plans, whichever they qualify for. So we have community health workers and promotores who are out in the community to be that trusted entity for in communities that sometimes don't trust organizations like us, uh, so that they are comfortable. And we take those services out as much as we can into the communities through health fairs or clinic flu drives or anything like that, or COVID vaccination drives, anything like that that can impact the community's health and well-being.
How does it feel for you to be helping the community?
It's why I chose this field. It feels really, really good at the end of every day to know that I'm leading an organization that has such an impact on people's lives, and has such impact on the communities that we live, work, worship, and play in. I've personally chosen in my healthcare journey to only work for nonprofit organizations, because the mission comes before the money. Now, we also recognize that without any money, there is no mission. So it's a fine line, but I really love the fact that we are basing our decisions on the mission driven work that we do, and hopefully then we find a way to make it work with the money.
Do you see, or any of your colleagues see, when people get the right care that helps their confidence level?
Absolutely. When you're healthy, you feel good, and when you feel good, you play good and you work good, and you just you walk around with a smile on your face, and that permeates with good deeds being done in the community. But we also recognize that for the most part, people don't come into our door within our doors because they feel good. They're coming in with they're hitting our doors because they don't,
Yeah.
and it's important for us to um, deliver the services that we provide with the compassion and dignity and respect that our patients deserve, regardless of whether they have commercial insurance or whether they can't afford to pay anything for that visit. It's immaterial to us. We're going to provide the care to everyone equally, and do our best to just continue to put that smile on people's faces when they leave here, knowing that the manner in which we provided the service made the difference.
What do you do to help your own mental health?
It's a good question. The first thing I do is I always try to look at every situation, and this job in particular, which can be a very difficult and taxing job, as glass half empty, and as opposed to, I mean, half full as opposed to half empty. That's the first thing. So my mental approach to things is the first thing that is important. My staff knows that different days I'll come into as soon as I walk in the building, I'm playing music out loud, and I'm yelling and screaming and going down the hallways, greeting people with a smile and a high five, just thanking them for being here today. But in addition to that, I try to go out and work out. I have found an awesome boot camp that I participate in here, it's a group of folks from all different walks of life and shapes and sizes, but we're all there doing support, doing what we need to do to support each other and help each other stay healthy through fitness. And then I like to do fun things like, play some golf when I can, go salsa dancing when I can. And I've been a Zumba instructor as well for the past 13
Wow.
years. So that's something that I'm also passionate about. And again, just trying to impact people's lives through fitness or through health.
What are some of the things that motivate you?
Um, there's a saying that I have with my team is that I'm not competitive as long as we're number one. So, uh, most importantly, that's the thing that motivates us. I want us to be the best at what we do because our patients and our community deserves that. So that's one of the things that really motivates me is to be the best for our constituents. The secondly um, is just everything that we do, every touch that we have with a patient that walks in our door, it's important for us to understand the impact that can have positively or negatively. We all are going to be sitting on the other side of that desk, on the other side of that exam table at some point in our lives. We all need health care. We're all going to have it for ourselves or our mom or dad or spouse or son, daughter, sister or brother. So we try to deliver that in the best way that we can in the same manner that we will want to receive it. So those are the things that motivate me every day.
And New Horizon is the brand new name for the health centers. What was that process like?
It was relatively an easy process. We know that we are in expansion mode right now. We are opening up our fourth location on September 3rd in Laguna Vista. And it's hard as we go through preparing for this expansion and the further expansion later on, either this year or next year. It was hard. We knew it was going to be hard to go into other cities with the name Brownsville Community Health Center. So, also, a lot of the connotation with that name was that we were the poor people's clinic. And we wanted to really shed that image and really start fresh and start new as the New Horizon Health Center, as we go through the expansion and as we really try to stress to the community why we're different and why you should choose our organization regardless of your financial status or your insurance status because of the way we deliver our services as well as the top-notch clinical outcomes that we have that rival any of the national leaders for chronic disease management.
You touched on it a little bit, but where do you want to see uh, the centers in the next, say, 3 to 5 years?
We changed along with our rebranding, we changed our vision statement to be quite simply to be a premier community health center in the state of Texas. So in the next 3 to 5 years, across all of the metrics that we can be judged off of, we want to be considered one of the best to do it all. And so that's the goal for the next 3 to 5 years. And then we continue to maintain that throughout the years.
Who can be a patient at the facility?
Anyone, literally anyone. Uh, we start with services with OB services. So from conception all the way through death, we are caring for patients at every age range. Again, as I mentioned, it does not matter whether you have insurance, you don't have insurance, you have Medicaid, you have Medicare, or any other of the commercial plans. We are credentialed for all of them. And we have a very special sliding fee program for those who don't have insurance and have difficulty affording health care. We are that bridge to access to health care, which we know is the first line of defense for being healthy, is having a place to receive care. And that's what we specialize in.
How can people reach out and learn more?
Well, our website is newhorizonhc.com. We are also on Facebook. We're on Instagram now at New Horizon Health Center. And then, of course, you can call us at any point at 956 548 7400. Any of our staff would be more than willing to talk to you and talk to anyone and answer their questions they have and make it easy for them to join our organization.